Andrew Phillips, PHI-LLIPS, and the medical director for the ECMO program at DHR Health.
Today's been a very special day here at DHR Health, Dr. Phillips, because it's the first year anniversary for the ECMO program. How exciting is that?
Oh, it's been very meaningful to everybody. One of the things that sets this apart and makes it a special program is that it's a comprehensive ECMO program. So it's not just putting people on ECMO and sending them to another facility, but we take care of them here, which it requires a huge multidisciplinary approach. And hitting this 1 year mark, and now 12 patients, actually somebody just yesterday we put on ECMO, establishes us as a solid center that this is working. It's working well. We have several patients who survived as a result of ECMO, and actually one is here with us today. And it brings it full circle, because a lot of us, we spend a long time. Often these patients will spend several weeks, if not months sometimes, on ECMO. And to get to see them not in the hospital and with their families, it's emotional, motivating, and just it's a great reminder of why you work those long nights and long days to see our community better for it.
So for the readers and the viewers that perhaps don't know anything about ECMO, can you define it for us, what it's all about?
Of course. So ECMO stands for Extracorporeal Membrane Oxygenation. And it's such a long name is why we then just call it ECMO. And it essentially it represents taking blood out of the patient's body, putting it through a machine that adds oxygen, takes carbon dioxide out, and then if we need to support the heart, it will flow it in a way that supports the blood pressure for patients. So these are for people who fail the ventilator. So a lot of people are unaware that even having 100% oxygen in a breathing tube, sometimes people still cannot survive. The lungs just cannot take any kind of oxygen. And previously in the Valley, someone in that circumstance probably would have died. And now, because we have ECMO here at DHR Health available to the entire Valley, those patients have an extra chance.
How new a program is it? I understand that you're the only one of this program's the only one of its kind in the Valley, but is it sort of a new concept?
So ECMO has changed a lot. The first concept actually was in the 70s, and it was for children. It was for mostly for children with congenital heart diseases, and it didn't really pick up for adults until the swine flu, 15 to 20 years ago. And centers started to realize that it could be helpful for adults, and then it started to push into not just pulmonary, but also for heart, cardiogenic shock, heart diseases and such. So it's been a growing technology. And the Valley is, to be fair, past due to have a program like this.
In the press conference, it was said that you are a Valley native, but that you went away and came back specially to run this program.
I did, yeah. So I left the Valley about 20 years ago. Some things have changed, some things have not. So I went to medical school at the University of Chicago, and then I did residency and fellowship at Stanford, and then I was faculty at UNC Chapel Hill. Most people know it for their basketball team. It also has a very good hospital, and there I worked in the cardiothoracic ICU. So these are the patients we were dedicated. That entire ICU was just heart transplant, lung transplant, ECMO, LVAD, all that. And then the pandemic hit, and the need was quite clear. And so I came towards the tail end of the pandemic. We couldn't have a program start fully ready for the period of the pandemic, but that set off the realization the Valley needed it, and no one had it. So DHR stepped up and put in the resources to make this happen.
Also at the press conference today, rather emotional for some folks, simply because of the focus on one particular family. Can you tell us about that?
Yes, so the family we're really honored to have with us, you spend a lot of time with these patients, and you see them on the brink of death. And this therapy really is a Hail Mary, and not everybody makes it. A lot don't. And so being able to see those who did really strengthens those efforts and that resolve. We take the absolute sickest patients who anywhere else would not be alive with ECMO, and we see if we can turn things around. And it is a very emotionally grueling task. There are no sicker patients in the hospital. There aren't. But the reward of seeing someone who otherwise would not be around. And in particular, I think with the gentleman who was here, with Phillips, that we got to meet his son. I'd seen pictures, but none of us had gotten to shake his hand and get to meet the little guy. I mean, how can it not get you right in the feels?
Are there plans to expand the program here?
So the first year we were focused on making sure that everything was flowing smoothly, that we were taking excellent, very good quality care of our patients. And now the next step, of course, is to be doing more outreach in order to take care of patients at other facilities that don't have ECMO. One of the challenges is that sometimes they're often too sick to transport. And so we need to be able to go place them on ECMO and then come back so that those patients are able to be on ECMO here in the Valley. And it's so much closer than San Antonio and such. So that's the next step, to make sure that we are available to all of the hospitals and all the patients in the Valley, not just DHR patients.
Well, Dr. Phillips, those are all the questions I had. Is there anything I've missed, anything else you would like to add?
It's an incredible team effort. And I think part of that, when patients are especially ill, it's not just some medicines, it's not just some x-rays or such. It really is the nutrition, it's physical therapy, it is the blood bank, it is laboratory. There are special labs just for ECMO patients. There are labs that we brought to DHR because we have ECMO patients. So it is a group effort that it was in some ways the thing that really made it a challenge to get off the ground, because there are so many parties involved. It touches every aspect of the hospital, but then at the end of the day also makes it incredibly strong because every group is supporting each other. And I gotta say, people were so enthusiastic to get started. It was, when we knew we were doing this and we knew we had the support of administration to pull everybody together, it's gone a long way, and the support between the services is fantastic.
Dr. Phillips, thank you so much. We've learned so much from this conversation. Thank you very much.
Thank you for speaking with me.